everyone, welcome to my channel. My name is Stephanie Ruiz and today's video is about the immediate postpartum period, what to expect as far as bleeding, discomfort, and how to take care of yourself down there. After your baby is born, you deliver your placenta. This is the organ that has kept a blood supply between you and your baby, helping the baby so it gets the nutrients and oxygen it needs while it's getting rid of the waste products while it's inside of you. So immediately after this organ detaches, it's like an open scab that's bleeding inside of you. So your uterus has to cramp up and clamp down to close those blood vessels and to stop you from bleeding too much. For the first couple of hours after delivery, your nurse or your care provider will be doing what's called a fundal massage. What this is very firm pressure rubbing on the top of your uterus, which is called the fundus, and this is making sure that your uterus is nice and firm and clamped down on those blood vessels, and also making sure that any clots or blood that's left in there gets pushed out, and make sure that you're not bleeding too much. This can be very painful if your uterus is tired from labor or if you have an incision from a C-section. It's important to make sure that your uterus is clamping down as expected because you can lose a lot of blood very quickly or hemorrhage, and this can be deadly if it's not caught quickly enough or managed correctly. It's also important that any blood or tissue that's left in the uterus is pushed out because anything that's left in there could be a source of infection. So no matter how annoying and painful these belly pushes are, they are very, very important. And you should thank your nurse for doing them because that means she cares about you. Over the next 3 weeks, you should expect some sort of discharge from your vagina as your uterus is healing. So whether you had a vaginal delivery or a cesarean section, you're still going to bleed from your vagina after you deliver your baby. Initially, this flow is going to be like a heavy period. It's going to be red in color and pretty moderate to heavy flow for the first few days. Your flow should get lighter, changing in color from a bright red to a reddish brown, then it'll move on to tan and then a yellow-white color. As I said before, you're going to be monitored very closely right after delivery to make sure that you're not bleeding too much. So what do I mean by too much? I want you to watch out for if you're soaking a big, large menstrual pad in less than an hour, or if you are passing large clots that are bigger than a golf ball size, especially followed by fresh flow of bleeding. You're going to want to let somebody know, either your nurse if you're still in the hospital, or if you're at home by this time because you only really stay in the hospital for 24 to 48 hours most of the time. You're going to want to call your doctor's office, your care provider's office, and let them know about this change in your bleeding. You should also go from heavy bleeding to light bleeding, from the bright red blood to the lighter color discharge, and not backwards. So if your flow is already pretty light and you're kind of in that tan pinkish stage, and then all of a sudden you have a heavy flow of bright red, fresh blood, you're going to want to call your provider. You're most at risk for bleeding too much in those first couple of hours postpartum, but it can still happen any time later on in the postpartum period. How to deal with your flow. So usually in the hospital, you're given these really sexy mesh underwear that are super stretchy, 3 sizes that fit almost anyone, and very large menstrual pads. You can definitely use these, and I would encourage you to take advantage of this. However, you can also bring in your own very stretchy, comfortable underwear and your own menstrual pads if that makes you feel more comfortable. Some people even bring in like adult diapers to help with any coverage issues, and some people prefer to use cloth menstrual pads. So whatever you're comfortable with, that's what you'll use. We talked about how the uterus cramps down to close those open blood vessels, and with this cramping, you're going to feel cramping like a bad period, and these are sometimes called after pains. If this is your first baby, you might not notice them that much, but with each subsequent pregnancy, the sensation becomes stronger and the after pains more intense. So that's definitely something to be aware of. These are also noted more during breastfeeding because the same hormones that cause milk letdown are going to cause uterine contractions, which is actually a really cool way of our body to help prevent us from hemorrhaging. The main medication of choice for these cramps is ibuprofen or Motrin. This is going to help with the discomfort as well as any swelling you might have on the inside. You can also use a rice sock or heating pad to help ease the cramping. Deep breathing techniques and repositioning are also great helpful coping mechanisms to help with these after pains. Over Over the 6 weeks of your postpartum period, your uterus is going to shrink back down to its normal size. So right after delivery, your uterus is going to be right about at your belly button level, and every day it's going to decrease just a little bit, about the breadth of your finger, until about 2 weeks postpartum, when it's usually not able to be felt in your belly anymore. So yes, that means you will still have a belly after you deliver your baby, even though you have 7-ish pounds of baby that you delivered and a placenta. You're still going to have a little bit of a belly. So if you're going to bring your own clothes to the hospital, make sure they are loose fitting and comfortable. Think t-shirt nightgown or some stretch loose fitting pajama pants or sweatpants. When you go home, you'll want to keep this as higher too. But again, remember, you're going to have to be okay with any of these clothes getting bloody or dirty or messy, especially the first few days right after you have your baby. So we've talked about your uterus, and now it's time to talk about down below. So what happens? After pushing a baby out of your vagina, it's likely that you have lots of different pains and discomforts to deal with all the stretching and pushing and physical trauma that tissue of your perineum, which is like your vagina, your butthole, that whole area of tissue between your legs, that's your perineum. All that trauma that your perineum has experienced, there's going to be a lot of extra blood flow to the areas. This is your body's way of trying to promote healing, but that blood flow means swelling, okay? You might look down at your labia, which AKA are the lips of your vagina, and see a couple of hot dog buns, or worse. You may feel a throbbing or bruised sensation with this. If you had a tear or a episiotomy, you might have burning, tingling sensation, especially when you pee. Oh, as a bonus, you also might have inherited some hemorrhoids from all the pushing and straining during labor. So how can you deal with this? I mentioned earlier that you can take ibuprofen. This is a systemic pain reliever, so that means it goes throughout your entire body, so it's going to help with cramps, but it also will help with any perineal pain and any swelling from down there. Heat and cold are really good options for helping with perineal discomfort. So if you have a lot of swelling, definitely go with the ice. You can fill a diaper with ice, you can fill a pad with water and freeze it. There's a couple different ways you can do this and apply it right to your perineum. So this is going to help decrease swelling, and it will kind of numb up the area, and both of these things will help decrease the amount of pain that you're feeling in your perineum. A warm, moist compress also can help relieve discomfort, as it helps promote blood flow to the area and encourages healing. So it can be kind of a more soothing thing. But again, if you have a ton of swelling, I would kind of back off on the heat initially, but still, you can try whatever works for you. If the heat feels better, go for the heat. As for medications, there are a lot of different things that you can get from the hospital that you also can get over the counter when you're at home. I encourage you to use these medications both places, at the hospital or your birth center and while you're at home. So one of these things is a numbing spray, and this looks like a little hairspray canister, and it does exactly that. It numbs the affected area wherever you spray it. So this is really helpful if you have any tears or if you had an episiotomy with a repair, because that area is kind of a little stinging, especially when you move. So if you use the numbing medication, it helps with any micro tears and kind of dulls that sensation. Witch hazel products or Tux pads are things that you can use as an astringent. It's really helpful to help with inflammation, and it decreases discomfort, not only on your perineum, like your vagina, but it also will help with hemorrhoids. It helps to decrease itching with hemorrhoids. So, like I said, the witch hazel pads or the Tux pads, you can line your pad with those. You can also get it in a liquid form and put it on your own panty liner or freeze them, making padsicles. And I've also recently found a witch hazel spray. So if you just want to spray it right to the area instead of messing with lining your pads with more things, that works too. Hemorrhoid ointment is another thing that is very helpful to be used as a topical pain reliever. And then if you have extreme discomfort and you're using these different products and these different medications, you can always definitely reposition yourself. Don't sit straight up. You can kind of sit on your side like this, take the pressure off so you're not sitting directly up, takes the pressure off your perineum. So that's going to help you to alleviate some of that discomfort, as well as you can get a pillow that has a hole in the center, or a donut pillow. That's good for hemorrhoids, but also, again, if your perineum is very swollen and very uncomfortable, you can get this pillow so it decreases that pressure right on that area if you do have to sit straight up, if you have to drive anywhere, sit on a chair for a long period of time. On top of keeping yourself comfortable, you want to keep yourself clean. The postpartum period is a healing process. You want to do everything in your power to help you heal completely and smoothly without getting an infection. Every time you go to the bathroom, make sure you bring your handy dandy little squirt bottle that they get you at the hospital. You're going to want to fill it up with preferably warm water is what most people like to use. The warm water is going to help be a little bit more comfortable, closer to body temperature. It's going to help prevent any jumping or clenching. That might cause a little bit more discomfort if you use cold water. But if you prefer cold water and that feels better to you, definitely use that. This is just completely preferential at this time. If you have any stinging while you pee, maybe because you had an episiotomy or because you had a tear that needed to be repaired, you can squirt the water on yourself as you're peeing. This helps kind of decrease the amount of discomfort and kind of let you be a little bit more comfortable so that you're able to relax and empty your bladder completely. Once you're done going to the bathroom, squirt the whole area, your entire perineum with your water bottle. Rinse off any blood, any urine, anything that might have been sitting around since the last time you went to the bathroom. And then you can pat yourself dry with either toilet paper or a small towel. So patting is a better option because it's a lot more gentle than wiping or rubbing. So it decreases discomfort that way as well. Another thing you're going to want to do is change your pad frequently. Even if you're not going to the bathroom that frequently, it's still a good idea to change your pad and your underwear very frequently to keep the area very clean and very dry. Using the products I mentioned before is really great, but also give your vagina an opportunity to air out regularly, to not be completely moist all the time, and to help promote healing. Another thing I want to mention quickly, although it's a topic for another video, another day, is using sitz baths or vaginal steams. Those are two things that are going to help promote the healing process as well as help ease the discomfort that you're feeling. So stay tuned for those videos because I will be working on those. Thank you so much for watching this video. I hope it helped to shed some light on the postpartum period, what happens with your uterus and your perineum, and maybe some really good tips of how to take care of yourself during the process. Like my video and share it with someone who could use it. Don't forget to subscribe to the channel so you can get alerted every time I post a new video. And also comment below for your ideas and thoughts on what videos you want to see next.